Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, April the 29th. We're honored to be here on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow, Friday, we'll be providing a COVID-19 written briefing at 3 o'clock, approximately 3 o'clock, with case counts and other relevant information about the COVID-19 pandemic in BC. Dr. Henry and I will be in Vancouver on Monday to deliver the in-person briefing on that day. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, we don't have all of the numbers in yet, but the overall totals are in. So we do have 874 new people who've been diagnosed with COVID-19 in British Columbia, bringing our total to 128,763 people who've been diagnosed with COVID-19. That includes 187 people in the Vancouver Coastal Health Region, 574 people in the Fraser Health Region, 29 people who live in Vancouver Island Health, 60 people in Interior Health, and 24 people in the Northern Health Region. We don't have the active cases and some of the people under public health monitoring at the moment, but those will be updated on the BC CDC dashboard later this afternoon. Of the cases that we have in BC, 503 people are in hospital right now with COVID-19, 178 of whom are in critical care or ICU. We have 7 active outbreaks in long-term care, assisted living or independent living, and 6 in acute care. We've had an additional 1 death, one person who's died from COVID-19 in the last 24 hours in the Interior Health Region, bringing the total number of people in British Columbia who've died from COVID-19 to 1,577. Our condolences go again to all of the people who have lost loved ones, to their family members, to their care providers. Our thoughts are with you during these difficult times. To date, we've delivered 1,749,375 doses of all 3 of the COVID-19 vaccines in British Columbia. Of those, 90,296 are second doses. Starting next week as well, we expect to receive the Johnson & Johnson or Janssen vaccine, which is a single-dose viral vector vaccine. And as I've mentioned, we'll be integrating this into our immunization program. And currently, we are finalizing the plans for that, and we'll share that information with you early next week. In the meantime, we are continuing with the mainstay of our program here in British Columbia, which is the age-based, risk-based program. And that includes going down in increments by age, because we know that even the age difference between 40 and 50 increases your risk of having more severe illness or hospitalization with COVID-19. And we're seeing that, unfortunately, in some of our communities in British Columbia. In addition, we've identified over 200,000 people who have conditions that put them at a risk that's commensurate with an age that is higher than theirs. And that's our clinically extremely vulnerable program. And that, again, has identified over, I believe it's 70% of people who received a letter have now received their vaccine. And we are booking people who are 58 and above across the province. It's important to know as well that we have had our priority worker program that was a little bit waylaid because of the concerns and the issues we had with the AstraZeneca program, but that has continued, particularly for first responders, for school staff, and for childcare staff. And it's about 15% of the overall vaccine that we've had in the last few weeks. And as you know, the amount of vaccine that we've had in the last few weeks has been constrained, which has meant that we've been able to do that by high-risk communities, and it's been prioritized around the province. Right now, registration is the most efficient way to get registered and to get your vaccine in our programs, the age-based program and the worker program. Registration makes the process seamless. When you're in the system, you will be notified. It's the most efficient way of getting notified when your age or risk category or worker category comes up. And you will be guaranteed your vaccine in that clinic that you have been booked into. And that's how we are monitoring and making sure that vaccine goes to those clinics where people are registered and where the vaccine is designated for them. And even though they may not seem busy at some times, that's because we have a lot of capacity to be able to deliver vaccines through those programs, through those clinics around the province. You will be notified and a vaccine will be reserved for you. And this program is the Pfizer and Moderna vaccines, primarily the Pfizer vaccines. And it has been slow, but the good news is that we will be receiving much more vaccine in the coming weeks, and this process will again be able to be sped up. In the next month, we expect to receive over 1 million doses of the Pfizer vaccine. And that means that our age-based program will be accelerated, and everybody will get their turn. In addition, our worker program will be able to be accelerated as well, because 15% means a much higher volume of vaccine that we'll be able to provide people in the coming weeks. So this is the good news, and this is what we have to look forward to in the coming weeks, where everybody will have access to vaccines, and every adult in British Columbia will have access to vaccines by the middle of June at the rate that we expect to go starting next week. As you know, in addition, we've been trying to reach certain populations that have not registered. And those populations, we have been doing targeted clinics in certain areas, doing outreach clinics, and as we saw this week in Fraser Health, trying some new and innovative ways to try and reach people through pop-up clinics or drop-in clinics. And we admit there have been challenges with those clinics, and those have been concerning in how we operationalize it. The good news is that thousands of people got doses of vaccine. But right now we need to regroup and determine how to best and most efficiently provide that vaccine to people in every community, but particularly in those communities where we know transmission rates are very high. And we'll be working with Fraser Health and with Vancouver Coastal and with our counterparts across the province to see how we can do that best in the coming weeks as more vaccine becomes available to all of us. As we know as well, people spread COVID-19. We spread it to each other, to the people that we're closest to, and we also spread it when we travel, even small distances. With the travel orders in place, we are all required to stay within one of our 3 provincial zones, unless it is for essential travel. And there is very good and valid reasons why many of us may have to travel, whether it's for work, whether it's for medical care, to receive a vaccine, or to support a family member in a crisis. If you are unsure, however, whether your travel would be considered essential, then you should be staying put right now. Stay within your community. While we know transmission is everywhere, we are seeing the greatest level of transmission in communities in the Lower Mainland right now. So for people in the Fraser and Vancouver coastal health regions, I'm asking you to pay particular attention. Our hospitals in these regions are feeling the strain more than ever. And hospitals in smaller communities don't have the capacity to carry any additional burden right now. Communities, especially smaller communities with limited healthcare services, are asking for your support by staying away for now while the provincial travel orders are in place. This means for people who live in the Lower Mainland zone and may have a second home or be planning to an escape to the Sunshine Coast or Sea to Sky corridor, I am asking you to stay away right now on behalf of those communities. Leaders in these communities are telling us they are not ready for an influx of additional people in the coming weeks. So between now and the end of the May long weekend, let's give those communities, some of whom, like Whistler and Squamish, have had tremendous challenges with this virus in the last few weeks. We need to give them a break by staying away right now. And we all need to continue to pay attention. Our cases are still much higher than we want them to be, and that tells us that transmission is still happening in our communities. And if I just reported, the number of people in hospital is at the highest levels that we have seen in these past few days. And people requiring specialized acute critical care is the highest ever. We're using every last drop of vaccine and will continue to do whatever we need to break the chains of transmission. But we need your help. We are in a tug of war with COVID-19, and I know most people are doing their very best, and for that we are very grateful. But when you get tired or frustrated or angry, as I know many people are right now, things can slip. We need to dig in our heels and use our collective effort and momentum to pull back. We can continue to be angry at this virus that has led to so much disruption and pain, but we need to hold steady in our efforts. We need to hold the line. Take the simple steps of sticking with our layers of protection, staying small, staying local, and following all of the orders in place. And get the vaccine when your turn comes up, as it will in the next few weeks. Your efforts, your kindness, your resilience, this was what will make us win at the end of the day. We are closer each day, and as this month of May is coming upon us, we will get there. We will get there, and we can do it by supporting each other, by remembering to be kind, to stay calm, even when it's challenging and frustrating, and to stay safe. Thank you.
Thank you very much, Dr. Henry. I wanted to start by offering my condolences to the families, the friends, the caregivers of the one person who's passed away in the last 24 hours from COVID-19 in British Columbia. That person was in the Interior Health Authority. It's a fundamentally difficult time to grieve the ones that one's lost, and we are with that family and those communities today. As Dr. Henry has said, there are 503 patients in hospital right now with COVID-19, and that presents significant challenges for healthcare workers, challenges, as you know, and I'll be reporting on surgeries shortly, that have been mitigated somewhat by the reduction of non-COVID patients in hospital, so that the overall hospital numbers are stable, but obviously the impact of increasing COVID-19 numbers, particularly in critical care, is felt. I want to talk briefly about vaccines, and Dr. Henry has talked about that, the vaccines that have been received. We've now received all 138,060 doses. The remainder that we're receiving this week of Pfizer vaccine, that it arrived, the final vaccine arrived yesterday. So that means that to date, as of the end of day yesterday, we've received 1,302,990 doses of Pfizer vaccine, and we've administered 1,189,756 of those doses. Obviously, we won't receive doses now until the beginning of next week when we receive more, 276,000. And so we'll be working our way through the remainder in the coming days. With respect to Moderna, we've received from the beginning of the pandemic to the present 354,800 doses, of which 328,281 have been administered. We're expecting to receive tomorrow or over the weekend 82,300 more doses. And with respect to AstraZeneca, where our reporting is a couple of days behind, because a lot of that has been delivered through the pharmacy system, we've received 314,700 doses and administered 231,338 doses of vaccine. I wanted to note that our clinically vulnerable effort, and from March 29th onward, people who are clinically extremely vulnerable have been able to register and book appointments. And to date, and you'll recall initially, we looked at that as about 150,000 people. In fact, 188,801 clinically extremely vulnerable people have already been vaccinated in BC, in every community around BC. And that includes a further 10,247 who currently have appointments booked. This is a significant achievement of our healthcare system, and we're very appreciative of the team led by Dr. Maureen O'Donnell at the Provincial Health Services Authority that has led this effort. I wanted to also say finally with respect to vaccine that if you have not registered for vaccine, and yesterday all those 58 and above, people born 1963 and before, are able to book appointments. But the system is to register either on the phone or online, and then as soon as you are eligible to book, you will be contacted and be able to book your appointment. And with more vaccine, 276,000 doses of Pfizer coming in next week, we will be moving down the age cohort. So if you have not registered and you are of any age in BC, above 18 and above, this is the time to register so that you can be in a position to book. Everyone in the coming 2 months will have the opportunity to have their immunization, their vaccine, their vaccination, and we want everyone to be ready to register. So register, register, register. This week's update on surgery continues from news that we provided last Thursday that 9 hospitals across the Lower Mainland were moving to performing only urgent and emergent surgeries. The decision to postpone non-urgent scheduled surgeries was made to ensure these hospitals had the critical care available to care for patients. This Lower Mainland action in the Vancouver Coastal and Fraser Health Authority remains in place. We recently reported that some postponements had occurred in Island Health to support staffing and capacity there, and this week the effort to support staffing and capacity continues. This has resulted in some postponements in Island Health as well. Island Health is performing urgent and emergent surgeries and focusing on delivering non-urgent surgeries that allow patients to go home the same day. I just, so with respect to the shift that began April 26th, that change in the way that we deliver surgeries and the postponement of non-urgent scheduled surgeries in Fraser and Vancouver Coastal Health, but a number of postponements were made prior to that as health authorities readied themselves. Today we can report the number of surgeries postponed from April 19th to April 25th was 398. It's 198 in Fraser Health, 197 in Vancouver Coastal Health, and 12 in Vancouver Island Health. It's important to note that no surgeries were postponed in Interior Health, Northern Health, or the Provincial Health Services Authority. So I want to report that for the week April 12th to April 18th, which is the week before last, health authorities completed 7,045 surgeries in total, of which 5,532 were scheduled surgeries and 1,513 were unscheduled surgeries. By health authority, that's 1,799 in Fraser Health, 1,285 in Interior Health, 418 in Northern Health, 1,735 in Vancouver Coastal Health, 1,488 in Vancouver Island Health, and 320 in the Provincial Health Services Authority. As this report and last week's report have made clear, this is a particularly challenging time in our COVID-19 fight, with pressures on healthcare staff and hospitals that we have not seen to this point of the pandemic. If we are among the 38.6% of British Columbians who have had our first shot, or if we'll soon get our first shot, and as good as we should feel about either, I would hope that these 2 surgery reports would help keep us focused, all of us, on those who care for us in our hospitals, those in hospital who need care, and those in need of surgery who have seen COVID-19 delay the surgery they had scheduled. Each of them, whether care provider, someone in need of care, or someone awaiting surgery, is counting on us to do all we can to stop the spread so that we can push back the COVID pressure on our healthcare system. And that means for all of us, keep using our COVID skills, that we keep following public health guidance, that we continue to adhere to public health orders, that we register for our vaccination, and that we ensure that when we travel, it's for essential reasons only until the end of the May long weekend. That's how we push back the COVID pressure on our healthcare system. That's how we keep safe. And that's how we keep making the difference that matters to those who are counting on us. Aujourd'hui, nous annonçons 787 nouveaux cas qui ont testé positifs au COVID-19 pour un total de 128 676 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 pour un total de 1577 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 500 3 personnes sont actuellement hospitalisées, dont 178 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to one question and one follow-up. First question, Richard Zussman, Global News.
I'd like to ask about hospitalizations in ICU. We have record-breaking number of people in intensive care, hospitalizations still over 500. Who are these people in hospital? Do we know if this continues to skew younger? And are these people that have received COVID vaccine or were eligible for COVID vaccine and did not get the vaccination?
Well, the last part of it, I cannot tell you on an individual level whether somebody wasn't refused the vaccine or didn't sign up for the vaccine. What I can tell you is that the majority of people, and I showed these data a few weeks ago, and it continues the same. And if you look at our the BC CDC surveillance weekly surveillance report, it shows that as well. What we are seeing is people from 40 to 59 have been increasing in hospitalization, and people 50 to 79 as well. And there's always been a relatively high rate of so per 100,000 in people over age 80. So additionally, still, age is the most predictive factor of ending up in hospital or ending up in ICU. What we have seen in the last week is that has started to come down again, which is good news, but we know it takes time before hospitalization and people who end up in ICU either recover or end up being transferred back to non-critical care. So that is a lag indicator, if you will. And yes, the majority of people were we do know that there are some people who have received vaccine who have become infected with COVID-19. But the rates of infection are order of magnitude lower after immunization. And most of the people in hospital right now are people who have not been immunized or was within the period of time before their immune system was stimulated by the vaccine.
Richard, do you have a follow-up?
I do, and I'm not sure how much of this is specifically your jurisdiction, Dr. Henry, and Minister Dix may be able to better weigh in on this. But what work is BC doing with Washington State or other jurisdictions in the United States to have cross-border vaccinations? In Manitoba, they announced today that teachers will be able to get vaccinated in North Dakota. Are those sort of conversations happening here, and is that something you support?
We've been prioritizing, as you know, staff in schools, and it has been relatively slow because of vaccine accessibility, but that is ramping up and will be ramping up. And we know that particularly in hotspots in the Lower Mainland, school staff have been offered vaccine. I have been in contact regularly with my colleagues in Region 10, it's called, so Alaska, Washington State, Oregon, Montana, and Idaho, and we meet regularly, and we do have discussions about this. And I express that the governor of Alaska and my colleague, Dr. Zink, were in Hyder and were able to provide vaccine doses to the communities of Hyder and Stewart last week. Also talking with Washington State about potentials, and the things that the people that I've been concerned about are cross-border truckers, and how can we have a relationship and access to vaccine for cross-border truckers. And that's a conversation we've had. I know government has had conversations as well at their level, but I'm not aware of any programs that have started at this point, but it is something we talk about. I know Point Roberts as well, there's been some discussions about access to vaccine. That's another community where we have arrangements so that people can go to school, for example, the young people from Point Roberts who go to school here in Canada. So there's a number of different discussions that are going on at my level, and I know at the Premier's level as well. Did you want to?
Next question, April Lawrence, Check TV.
Oh, hi, thank you. Minister Dix, I just wanted to clarify one thing you said about the surgery cancellations in Island Health. You mentioned 12 had been canceled. that was only till the 25th. I'm just wondering if there's been more since then. And I'm wondering if you can tell us if it's because patients are being transferred here from other health authorities, and if so, if you know or can tell us how many have been transferred into Island Health from other health authorities.
The number 12 is for the period between April 19th and April 25th, and we'll be reporting in detail next Thursday about further cancellations. On Island Health, it has nothing to do with people being transferred here with respect to COVID-19 in any way. Island Health has done a truly extraordinary job of doing surgeries in the past period such that wait times and wait lists are significantly smaller than they were at the beginning of the pandemic, which is a real achievement in Island Health. But I think what you're seeing in Island Health is the ongoing significant pressure on the healthcare system, very partly related to COVID-19, because there are some cases in Island Health hospitals, but overall in the healthcare system on Vancouver Island for surgeries and everything else has been going very consistently in the last period, and in fact we've been making significant progress. So these are adjustments, and they're really hard for patients when we have to postpone a surgery or delay it for a period of time, and to the maximum possible extent we avoid that. But Island Health's situation has nothing to do with the COVID-19 situation or transfers from other health authorities.
April, do you have a follow-up?
Yeah, just a clarification further on that. Would it then be fair to assume it's because of staffing issues, or is there staff burnout, staff sick time? Is it more related to that?
Remember, there are two groups of people in hospital. The vast majority of people in hospital right now are not related to COVID-19. In fact, the numbers in acute care province-wide are fairly stable, although the pressure on hospitals such as Surrey Memorial, for example, is great because of the COVID-19 pandemic. So on Island Health, there's a lot of pressure, and there's a lot of pressure in particular hospitals all the time. I think of Nanaimo Regional General Hospital and all the great work done by staff there. So what you're seeing is some significant pressures in terms of non-COVID-19 cases in hospital, as well as a small amount of pressure, because there's not a lot of people in hospital with COVID-19 on Vancouver Island with that. So all of it, after a year of the COVID-19 pandemic, does put pressure on staff. Not a very relatively small number of surgeries are being postponed, but we want to be transparent that that's happening here as well, but for reasons other than directly the COVID-19 pandemic.
Next question, Penny Daflos, CTV.
Very much for coming to me. Dr. Henry, you called them new and innovative, but a lot of people missed work, some of whom could ill afford to do so, to wait in line for a vaccine pop-up that they heard about through social media or text rumors. So some who waited didn't even get a vaccine. They're frustrated, disappointed, confused by these unannounced pop-up clinics. I mean, some of which didn't even check addresses to see if people were eligible. Ultimately, the buck stops with you, so I'd like to know, will you take responsibility and apologize for the vaccine free-for-all?
I'm not sure I would call it a vaccine free-for-all, but absolutely. We are concerned about the way they rolled out. These were done with the right intentions, that people were notified through means, and as you say, it got a life of its own that was not anticipated in social media in particular, and that made people do things. And, I do have to say, if you're not in those communities, do not go to those communities. You will get your vaccine, and there's enough vaccine coming in the next 2 months that everybody will get their turn. And the most efficient way to do it is to register, and you'll be notified as soon as your age category comes up, and you can book yourself into the clinic that will have your vaccine for you. But yes, there were some operational things that were done or not done that caused a lot of frustration, and I can see that, and I absolutely apologize to people for the miscommunications and for the confusion. That was certainly not the intent. The intent was to try and reach those people in those communities that we know have challenging times, and where there are barriers or there's challenges in getting access to people have not been registering. So those are directed at those communities, and we will be working with Fraser Health as we do every day to try and make it more smooth and better for people. But just to remind people, the main part of our program where most of the vaccine is going, primarily based on Pfizer, is the age-based program, and the easiest and simplest way to do that is to register either by phone or online, and you'll get your vaccine. And I will encourage everybody to support their communities to do that. And we will be doing additional initiatives in Surrey, in those communities where we know there's challenges, through community groups, through church groups, through gurdwaras and others in the coming weeks as well, to try and reach as many people as we can, as quickly as we can.
Penny, do you have a follow-up?
I do, and thank you very much, Dr. Henry, for that answer. I'm hearing that from experts that research from the U.S. points to vaccine hesitancy among racialized communities in particular, not actually being hesitancy, but more vaccine confusion, where and how to get vaccinated. Right now in BC, we've got an official provincial website, we've had pharmacies with their own system, we've had the rumor mill and vaccine hunter Twitter accounts that have people driving all over the place for these pop-ups. The vaccine rollout comes across as both confusing and confused. So I would just like to know how you're going to rebuild public trust after this, and in particular, address vaccine confusion.
Yeah, and vaccine confusion can be driven by many different things, as you mentioned. The people are spreading rumors, and the things that we are saying we have one provincial system. It was a transition early on. We had several different systems, and we've had different issues with vaccines, and that is a reality. The reality that we faced is the Moderna vaccine doesn't come in regularly. We're hopeful that that will change. The Pfizer vaccine had a period of time where it didn't come in at all for several weeks. We've had issues that we've had to investigate with the AstraZeneca vaccine that meant we had to change the worker program that was based on. So it is the reality that things change. And they change based on the information that we get, on the supply that we get. But right now, the most important, the mainstay of our system, and that has worked for over 1.5 million people already, is the age-based program, because we know that's the most important risk factor. And that will continue. And starting next week, we are confident we will have more vaccine. So it will make it seamless and easier for people in the next few weeks. And that every adult in British Columbia before our July long weekend is going to be eligible and be able to access vaccine. And so we need to all just regroup and know that there are many different ways that we're going to do this. We had to start off slowly with certain people who are at highest risk. We know in long-term care, for example, our elderly population. And I think that's the success that we see. In our elders and seniors, over 83% of people over the age of 70 in this province have been immunized. Those are the successes that we see, and that will be there for all of us as we go through these next few weeks. And I know there's many different reasons why certain communities, they find it difficult to go online perhaps, or there's a lot of people who have questions, and we're working at how do we connect with people to make sure that their questions are answered in their language, in a way that they understand. And we can always do better on that, and we'll be working on that, particularly as more vaccines arriving in the coming weeks and months.
Next question, Lisa Yusta, News 1130.
Following up on what Penny asked, I think the sense a lot of people have is both panic about getting vaccine and then feeling ripped off when they see that they're either on the edge of these communities that are getting these hotspot clinics, or that they work in them or they go through them, and that they're feeling ripped off and they're feeling like they're getting left out with this age-based program. So I wonder if you can just talk to that panicky feeling and the anxiety a lot of people are feeling.
I know, and it's really tough right now as we see case rates being very high. We see people in hospital, and we want to do our part to be protected ourselves, but also I know that to protect our families, the people we're closest to. And it has been incredibly challenging to stand here and know that we only have a limited amount, and how can we get it to people in the most efficient way. But I can be reassured, the things that we need to do are the things that will protect us in the meantime. And we need to keep doing those. And we have seen great success where we've had communities vaccinated. If we look at First Nations communities around the province where we've had a whole of community approach, many of the small communities where it didn't make sense to go in multiple times, we've had great success in a number of our high-risk industries where we have focused on our temporary farm workers, making sure they're protected so that they can do those essential work. The fact that we've been able to immunize all of the large food processing plants in the province, those are real successes. And sometimes it seems like it's all over the place and it's everybody but us. But each person, each community, each business where we are able to protect people that way is good for all of us. But it is taking longer than we would like, where we have clinics that are ramped up and ready to go as we're receiving more and more vaccine in the coming weeks. So your turn will come, and I think we all need to just take a deep breath and know that there is vaccine for us, and it will be coming, and we will get it, and we need to celebrate for every single person who's immunized, because all of us collectively will get there in the next few weeks.
Lisa, do you have a follow-up?
One of the other things people are wondering, they were anxious waiting to see their 58-year-old group called. Why can you not set a new schedule saying it's 58 today, it'll be 57 on such and such a day, and then going from there?
Yeah, that's what we will be able to do once we get everybody in the registration, because then we know the exact numbers. So it's challenging. It will be more like that as more vaccine becomes available. It has been a balancing act of vaccine coming in, and we've been down to less than 10,000 doses in the entire province on a Monday afternoon. So it is really trying to titrate as much as we can. And the best thing that we can do to make that easier and be able to forecast a little better is for people to be registered. So you're in our system, and we know we can contact you as soon as we get those vaccines in those clinics. And so it's not a simple thing, and to try and distribute vaccine to the many clinics around the province and know exactly who's going to be where when and how much is going to come in when. And we've been trying to do it without canceling clinics, because we know how discouraging, talking about feelings of disappointment and anger and frustration if clinics are canceled. And trying to get as much out as fast as we can. So I believe that we are going to be in a different space, hopefully when the Pfizer starts arriving on Monday, where we will have enough vaccine to really accelerate those clinics. So everybody, go right now, go talk to your friend, help them, register right now with our vaccination. What's it called? With the vaccination registration. Get vaccinated, I'm sorry. And that's talk about confusion. So right now, go get registered, and as things speed up in the next few weeks, it will go down in age very quickly. Yeah.
And just to add to that, it was 58 last night, but we can register anytime. It's really important that people, because it's going to come much more quickly in the next couple of weeks, year by year by year, as you suggest, Lisa, and so it's really important now that people be registered. If you're 58 and above and you haven't registered yet, you're going to register and then be able to book right away if you're in that category. But if you're anything below 58, this is the time to register, because then you can book your appointment at the first possible moment. You'll be contacted by the immunization team, either by text or by phone or other means, and you'll be able to book your appointment right away. And it's very, very important that people register. I just wanted to say, with respect to the overall program, over 70, we targeted people on an age basis. Over 70, more than 83% of people immunized over 70, which shows the effectiveness of that. 188,000 people clinically vulnerable, immunized, because we wanted to focus on a group of people who was clearly more vulnerable to COVID-19. 205 First Nations communities immunized across BC. And many, and especially local and rural health areas, which are farther away from acute care, have been immunized at a greater rate than others. We have 25 local health areas that have been immunized at more than 50% of the eligible population for their first dose. 25. Those are disproportionately in rural areas, and that is for good reason. And so all of that shows that the targeting that's taken place, long-term care, assisted living, older population, clinically vulnerable, rural and remote communities has been effective in the vaccination campaign. And we'll be providing some detailed information next week by local health areas that we'll be able to update so you'll be able to see. And there hasn't been significant variation as between local health areas. There are the rural and remote ones, and those with a larger Indigenous population that are at a higher overall level. But across the system, there are only now under 30% vaccinated. Only 4 local health areas in the entire province under 30%, and so the variation between health authorities is not that great, which means everyone is getting access everywhere. There's some differences between rural and urban and between health authorities in the specific strategies that have been used. And I'll just talk about one finally. In Windermere last week, if you recall the chart, the local health area of Windermere or in Columbia Valley was the highest level in interior health today because of a different approach, but similar approach to what has been happening in the Fraser Health Authority. Over 50% of people in Windermere have been immunized, as is in Revelstoke, as in Prince Rupert, as of course you all know in Whistler.
Next question, Jawad Siddiqui, Connect FM.
Hi, thank you for taking my question. My question is for Dr. Bonnie Henry. So Dr. Bonnie Henry, you call these pop-up clinics innovative. So my question is, if they are effective, why not commit to improve the communications and outreach around them instead of apparently just shelving the idea for now?
Yeah, and that's what we've been talking about, and I talk with Dr. Lee and Dr. Elizabeth Brodkin in Fraser Health on a daily basis about, what were the things that worked and didn't work in those. So I'm not saying we're writing them off, but we are out of vaccine right now as well at this point in the week. So we will be looking at where are the things that worked and how did they work and how do we do better at it, and we'll be looking at that in the next little while. But hopefully, we made the point today that the best way to guarantee your spot in your vaccine is to register, and it'll be there for you. So you don't have to worry about whether there's a pop-up clinic in your community or not.
Jawad, do you have a follow-up?
I do, thank you. And I have many follow-up questions, but I think I'll go with this one. So what suggestion do you have for media in this case if we encounter such a pop-up clinic which is unannounced in near future? How do you want media to react to that? Do we just let it be or let people know that there is one unannounced clinic in their area?
Yeah, so the way, and that's a very good question, and thank you for that. Some of the things that I saw happen were rumors being spread on social media, and sometimes that's not helpful. I know that Fraser Health was looking at getting it out in a community on a grassroots basis, and sometimes that goes crazy, and it reminds me how we are in a very, very connected world. So yes, we would appreciate getting the message out that these types of clinics are targeted to specific people for a reason, and your help in getting to those people would be great, particularly people who speak languages other than English. We know that sometimes that can be a challenge in finding the information they need to be comfortable being immunized, so that's one of the things that we try and do, and to give the message to others. If you don't live in Newton, don't go to the clinic in Newton. It's designed for that community. We look at our cases by where people live. And so case rates that are high in a specific community reflect people who live in that community. And that's why we try and target the clinics to make it easy for people in those communities where we know there's a lot of transmission. And, we talk about in Surrey, for example, a lot of the communities are people who work in food processing or in your grocery store or healthcare workers and live in larger multi-generational families. So we need to reach out in ways that that speak to those people to make sure they're comfortable and know how to access vaccines. So if you're not in that community, your community will be targeted perhaps in a different way. And there may be other ways that will reach out to you. So yes, we are trying to do things differently, trying to figure out what's the best way to reach people and provide them with the information they need to access vaccine and to get all their questions answered as well. And we'll continue to do that. And your help would be greatly appreciated.
Next question, Colton Davies, Radio NL.
Hi, Dr. Henry. So we keep getting surprised a little bit as media and people in the public with learning through social media that pharmacies suddenly have vaccine supply available. An example in Kamloops is that the BC Pharmacy Association website says that all the local vaccine clinics don't have AstraZeneca available, but we've seen today even that Walmart now has doses for the next 5 days. Shoppers has doses on Monday. And I'm just curious, Interior Health says that the Pharmacy Association is the middleman with doses administered at pharmacies. So does the Pharmacy Association need to better communicate this information? I just feel perhaps finding out about these clinics on social media maybe isn't ideal.
Yeah, and it's another one of those challenges that we have. So right now, it's the fridge-stable AstraZeneca vaccine, and that has been available through the pharmacies. And we've partnered with the pharmacies to do that, but they have to meet certain criteria. One of the most important things that I said from the very beginning is that every single dose and every single lot number needs to be recorded in our provincial immunization registry. So not all pharmacies are connected to the immunization registry. The pharmacies that deliver our influenza vaccines are the ones that are more likely to be associated or connected to the registry, but we've needed to add additional information around these specific vaccines. So that was one of the factors that the Pharmacy Association used in determining where vaccine was going. We also wanted to make sure that we addressed those communities that were having the highest transmission risk. So there's a whole lot of factors that went into how much vaccine went where. But then once it goes out into the pharmacies, we lose a little bit of line of sight because there's a delay for when it gets entered into our immunization system. Different pharmacies have different ways of notifying people about when they have vaccine, and so it is more complicated when we deal with pharmacies. They've been doing an amazing job in getting the vaccine to people, and as you know, there's also been changing criteria about who's eligible for vaccine. What I can say around the AstraZeneca vaccine is we don't have any indication that we're going to be receiving more in the short term. And for people who've received it already, we do have guarantees that we will get some of it to be able to provide second doses for everybody who needs them. And so that's something that we're working on with the federal government, and we have confidence in. But the other sort of complicating factor is the systems that pharmacies use to be able to provide people with AstraZeneca are not always, they take some time to connect them with our provincial registration system. So if you did get your vaccine in the pharmacy and you're going to be notified about your second dose, you're very likely to be notified by both the pharmacy and the provincial system. But to make it simple, just go ahead and register in the provincial system, and that just makes it simple, and you will get a notification from our provincial system as well. So, which is all to say, none of this is simple. It takes, we're talking about 600 in some pharmacies around the province. All of them have slightly different ways of doing things. And yes, some of them have vaccines still available. It may be, well, what we do know is that in areas where there wasn't as much uptake, vaccine has been transferred to pharmacies where there is more demand. And that continues to happen, but there's very little AstraZeneca left in the province right now.
Just really briefly, Colton, about 180,000 doses of AstraZeneca have been administered through pharmacies, which I think is an extraordinary achievement. There's about 10,000 left out there. that has either been administered and will be reported within 24 hours, or is still to be administered. So there is a little bit of AstraZeneca out there, but essentially, as you can tell, the pharmacies around BC have done, I think, a really good job at delivering AstraZeneca around BC to initially a limited cohort, people 55 and over, and now a slightly larger cohort. But I think they've done a very good job, and we know that they're going to continue to assist us as we move through the pandemic.
Colton, do you have a follow-up?
Yes, I do, and I appreciate that detailed answer from both. I just wanted to ask as well, because tomorrow morning we're expecting to hear details on enforcement and how that will look for road checks, preventing travel between zones in this province. We also know that, it's been said that the spread of variants is the main reason for these restrictions, and I suppose this would be for Dr. Henry, but perhaps Minister Dix as well. And do you worry about people potentially bringing in the virus and its variants into Interior Health and Northern Health who enter BC from Alberta? Because, of course, BC cannot restrict travel in or out of Alberta legally unless Alberta and BC both decided to.
Yeah, so I think we need to be a little bit cautious about talking about variants, because it really is people, and we know that people are infected with the virus, and sometimes we figure out which strain of the virus they have, and we know it's been changing over time. And what we have seen, though, is that the virus that people are being infected with is more transmissible lately, and that's because, it turns out, many of them are infected with a variant, and it's probably around 75% of cases. So we assume that everybody has it. And that's the same across the country right now. Yes, we are concerned about people traveling in from Alberta, and we're asking people from Alberta not to come here now, even if they have a second home here, even if they want to come here for recreation and they do it every year. Now is not the time to do that. We will welcome you when we are all in a better place in the summer.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will be releasing a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Last question, Tanya Fletcher, CBC.
Thank you. And this first question's a two-parter. The first one to Dr. Henry, the second part to Minister Dix. Dr. Henry, you mentioned the frontline worker vaccination program will be expanded with the next round of shipments next week. Can you specify which workers will be prioritized next and when exactly they should expect to be immunized? And for Minister Dix, you said in question period today that these pop-up clinics have not been successful because they've undermined confidence in the process. How was this not foreseen?
I can answer that one too. But, I may not agree entirely with that assertion that they undermine confidence. It really was an attempt to try and reach out to communities where we weren't getting a lot of registration, and we wanted to be able to provide vaccine in a way that was easier for people and less restrictive. And yes, the communications didn't work out the way they should have, and operationally they didn't. There was confusion, as you indicate, and that led to people being frustrated and angry in some cases. On the other hand, they did raise awareness in certain communities about the need for immunization and about our need to do better at reaching out. And so that's what we will learn from those. And then I've completely forgotten your first important question to me.
Oh, it was just about specifying which frontline workers should be expected to be vaccinated next week.
So, we've already, when we had to shift our focus with AstraZeneca, we really wanted to prioritize which groups we would start with the limited amount of vaccine, and it's been about 15% of the vaccine that's come in over the last few weeks, and that is first responders, so police and fire services, school staff, and childcare staff were the groups that we prioritized with our immunization committee and a public health team. knowing the amount of vaccine that we have. So a good proportion of each of those groups has been done. We started with the people in Surrey, for example, in those 3 categories, and moved around the province. As we have more vaccine coming in, 15% will now mean a lot more vaccine available, and we expect to have those groups completed in the next 3 weeks. So by the end of by the middle of May. So that's the goal. We are also continuing to provide immunization as we can as an outbreak management tool, and we're looking at that right now in the outbreak that's happening in Site C in a number of different places around the Lower Mainland, and we will continue that program as well. That's a much smaller proportion of vaccine, and as the Johnson & Johnson vaccine becomes available next week, we'll be targeting others on that list that we came out with in our optimistic days in the end of March, hoping that we would have more vaccine available in April. So on that list, of course, are people like cross-border truckers and others. So we are in the midst of looking at how to best target the other groups on that list in the next few weeks. But I will say that as we have more vaccine coming in, the vast majority of it goes to the age-based program. So many people who are on that list, whether you work in trucking, whether you work in schools, or whether you're in the grocery store or distribution centers, which is another area where we've seen a lot of transmission of vaccine. If your age comes up, get your vaccine through the age process. That's the most efficient way to do it, and we will try and target vaccine to younger people in those occupations as soon as we can as well.
Thanks, Tanya. I think certainly what I'm saying is that if you look across the province, we've used the vaccine virtually as it arrives, particularly the Pfizer and the Moderna vaccines, to a remarkable extent. 83% of people over 70 have received their immunization, their first immunization. That was an important target, and it really is a significant success, and you see it across health authorities across BC. 188,000 people clinically vulnerable, most of them contacted by mail, old-fashioned paper, and contacted and have come to clinics and have been vaccinated. That's an extraordinary success to find that group of people, to work with that group of people in communities in every part of this complex province, and to do that vaccination is extraordinary. The work that's been done with the First Nations Health Authority and Indigenous communities across the province, excellent. The work done and its impact on long-term care and in assisted living, excellent. The fact that the experience of people, the overwhelming number of people at vaccination clinics has been positive, and I hear from them every day. And so what I mean by that is the challenge with this kind of situation where there are lineups is that it takes away from all of that, from confidence, and we have to simply rebuild that. And what I would say, though, is that I expect health authorities to be innovative and to work with communities. In Dawson Creek a week ago, we had high levels of transmission and the lowest level of vaccination in the province, and that has changed because of innovative action by the Northern Health Authority. In the Columbia Valley, a similar situation in the Windermere Local Health Authority. You saw what happened in Prince Rupert. And so we have used tactically immunization. It's a different challenge when the areas you're targeting are in a large metropolitan area. But what we want to do as well is to encourage our health authorities to use every means possible to reach out. And what I'm asking people today is, given the success of the age-based program, of the clinically vulnerable program, to please register. The more people that register, if you register, you're going to get your chance to be vaccinated in the soonest possible time. And that's what we need to do today. So my core message is register, register, register. And we're going to continue, and I know everyone involved in the immunization campaign is going to do everything they can to make sure you get the vaccine you need at the soonest possible moment.
Tanya, did you have a follow-up?
Yes, thanks. And an answer in French from Minister Dix would be appreciated. Thank you. Can you please clarify why the system to notify people in hotspot areas about the pop-up clinics doesn't appear to be working? The overwhelming majority of people who actually live in those communities that we're hearing from were not told about these clinics, even though they had all registered online prior. So were emails sent? Was it text messages, phone calls? Can you say how many people residing in those areas were actually notified?
No, I can't give you those details. Obviously, the operational details are what Fraser Health does, and I know they reached out through specific community groups and others. And yes, we do know that things spread very quickly on social media from certain people, and that happens. And it is the challenges in a large urban area like that, which are different from smaller, less populated areas. So I know that they are regrouping and looking at what worked and what didn't work. I know next week we are looking at some of the outreach through Gurdwaras, for example, and there will be continued to be different ways to outreach to different communities. And I think the really important thing that you mentioned is, people, the registration is the way that you will get a guaranteed vaccine in your clinic. And we need to find ways to answer people's questions. And that was one of the discussions that we've had in several different communities where there's a lower rate of registration. Is, what is that? Is it because people don't know how the system works, don't know where to go to do that? Or is it because they have questions and they're not ready yet to commit to being part of the immunization program? And that's something that I'm going to be looking at and working with colleagues across the province to make sure we're doing it in the right language, in the right tone, answering the right questions, and doing better at that to encourage people to get into that stream of getting immunized as quickly as we can. So there's still many, many things to learn as we go through this, and It's Our Shot is one of the programs that is designed to reach out to different communities, and we want to be part of that as well. Looking at, how do we engage with people who know their community a little better to find out what the barriers are and remove those barriers. And so there will be more experiments as we go through this, and as more vaccines available and we get it to more and more people across the province. And can I just say before I turn it over to Minister Dix, I forgot to mention as well that our Speak survey is out there still. We've had about 150,000 people who have answered it so far, but this is the second survey that we've done to ask just these questions. What are the things about the pandemic that have affected you and your family? And we know the first survey, over 400,000 people answered, and it was very helpful for us in understanding the impacts that the pandemic, as well as the measures we've put in place, have had on people. So particularly, I want to ask people living in rural and remote areas, men in particular, under the age of 35, so young men, people 75 and older, and anybody from different ethnic groups around the province. Please answer the survey. We want to hear from you and help those elders and seniors in your life answer the survey as well, to share their stories. And it's on the BC CDC website, the COVID-19 survey, and I encourage everybody to take part in that and tell us your story. Thank you.
Oui, il y a une quarantaine de community health service areas dans la région de santé de Fraser Health. Une dizaine entre 6 à Surrey, un à Delta, un à Port Coquitlam, un à Abbotsford et un à Langley étaient désignés comme priorité à cause de le niveau de transmission et un niveau relativement bas de vaccination. Donc c'était de cette façon-là que ces Community Health Service Area étaient choisis pour ces programmes spéciaux. Et on a eu un programme, une clinique de vaccination à Langley pendant le week-end. Et évidemment, il y en avait à Surrey, aussi à Coquitlam, depuis 2 jours. Pour la première journée de cela, mardi, c'est 10 Community Health Service Areas qui représentent un quart de la territoire de Fraser Health, représentait à peu près 50% des vaccinations dans la totalité des vaccinations dans la région de santé. C'est-à-dire que cela, d'une certaine manière, a marché, mais l'effet, évidemment, sur des communautés, ceux qui ont participé à ces cliniques de vaccination n'était pas positif. Donc, on travaille là-dessus, on apprend, on fait mieux. Merci beaucoup. Thank you very much. We'll see you on Monday.